Congresswoman Ms. Lee for her time. I yield back my time.
Thank you, Mr. Chair. My colleagues have touched on this throughout our hearing today, but to get to the heart of what we're talking about, improper payment simply means that the government did not or cannot tell whether it's payments to the right person, got payments to the right person, or in the right amount. Ms. Williams-Brown, overpayments, where the government sent more money to someone than they were supposed to receive, are considered improper payments. Is that correct?
Correct.
About what % of errors in payments were overpayments?
90%.
Goodness, that was more than I thought. Overpayments aren't necessarily fraudulent. It could be that someone isn't even aware they received an improper overpayment, right?
Yes.
Thank you. So the Social Security and Disability Insurance programs have a history of these types of overpayments, ones where the recipient isn't even aware they were overpaid. Ms. Brown, if the Social Security Administration somehow overpays a person's Social Security benefits, the Social Security Administration is required to take that money back. What are some of the ways an agency like SSA might try to get that money back?
So they have a number of possibilities. In some cases, the person can to repay the amount in full. There may be payments made over time. So there are a range of actions that an agency like SSA could take to try to recoup it. Some agencies associate it with refunds, federal refunds. In some cases, waivers are a possibility. So there are a range of potential actions.
So as you said, we've seen in some cases, SSA would dock a Social Security recipient's monthly benefits entirely, though, forcing some seniors and those with disabilities to lose their homes or go without food. So the government makes a mistake, and the person on Social Security benefits, who was likely unaware of the overpayment, pays the price, literally. Fortunately, as a small fix, by this administration, recipients of these overpayments now have nearly double the time to repay the government than they had previously, but more time can still be a problem. So recouping overpayments has real kitchen table, as we call them, implications for seniors and people with disabilities who rely on Social Security benefits and live on tight budgets. Any change in the amount can mean less food or a missed mortgage payment or foregoing medications. These heartbreaking scenarios could be prevented if the government leveraged technologies to more effectively track program payments from the outset. Mr. Horowitz, the PRAC has made great strides in advancing how the government uses data to prevent improper payments and pandemic spending. What have been some of your greatest successes?
So, Congresswoman, I think you're absolutely right. You know, one of the things that what we've been able to do with the analytics efforts is, well, first of all, support tracking down the fraudsters. Because, as I said earlier, these are people who stole money from the public, who harmed intended recipients. So that, I think, has been very important. But I think another thing that we've done that has really changed the way we do oversight is we've worked closely with our state and local oversight partners, with state auditors, county officials, with GAO, which we had a close relationship with before this, but working with state and locals, we got word to them early on about fraud alerts that we were seeing, so they could do, as you said, stop things early, prevent it early, and thereby ensure money was going to go to the beneficiaries, the unemployed, the small businesses, not the fraudsters.
Certainly. And Mr. Horowitz, a lot of that success also has been through leveraging cyber talent and data analytics to improve these processes, correct?
Correct.
Would codifying the analytic capacity of the PRAC help combat improper payments or, and overpayments?
Absolutely, they would. It is such an important and potential prevention tool that we just shouldn't lose.
Thank you. So improper payments, they just don't exist in the government contracting world. It affects real people who rely on these benefits to live. No one should worry about affording their prescription drugs or putting food on the table because the government is clawing back on overpayments that they didn't even realize they received. I'm hopeful that this upcoming scorecard will incentivize agencies to use technologies that prevent these improper payments. Of course, our constituents deserve nothing less, and also it is something that is anxiety-inducing and truly, you know, punishing folks who've done no wrong, but still, we have to make sure that we're correcting these.
And you're exactly right, Congresswoman. Can I add to that?
Please.
As I mentioned earlier, you know, there are people who were the intended beneficiaries who fraudsters beat to the unemployment line, and they had to prove they were the real person. And for someone who doesn't have the money and who needs the unemployed, very hard for them to find someone to help them get through the agency bureaucracy at that point, right? In addition, I bet you all of your constituents were the victims of an identity theft and a fraud that occurred. They were not beneficiaries. They were simply people whose identities were stolen, who learned after the fact when they got a 1099 from the IRS or a notice from their local government that somehow they got benefits that they never got. And those are victims here also, I'm sure, in every district in the country.
Yeah, thank you so much for that. I thank you all for your time, and thank you to our chair and ranking member for this important hearing. I yield back.